Hi, welcome once again. My name is Dr. Jay Lim and welcome to another series of a Keep It Simple series whereby we talk about common urological problems and know more about it. Now, we'll be changing the format somewhat with this new video. Instead of now talking about a particular pathology and what can be done around it, we're going to focus today instead of a procedure. And the first procedure that I'd like to talk about is a common one, and that is a flexible cystoscopy. There are many reasons as to why you would do a flexible cystoscopy, as some of you would have seen me in the clinic would know. Some of the reasons would be if you have a particularly bad urinary tract infection that refuses to go away, you've got blood in your urine, or you previously had issues in the bladder that you want to continue to make sure everything now is clear and gone. In addition, there are many ways as to how flexible cystoscopy can be done. You can be doing it under local anesthetic whereby there is gel, or you can do it under mild sedation, or even under general anesthetic if necessary, and today we will be going through it. The complications of flexible cystoscopy is a lot less because it's generally a very safe and it's a very fast procedure, yet it gives me a lot of information about the health of your prostate. So hopefully through this video, everybody, including you most importantly, would have a good understanding of what you expect on the day of the procedure so that everybody can have an easier time going through this flexible cystoscopy. So today we're going to change the format somewhat, and instead of going through a condition and understand a bit around it, what we're going to do today is instead to take you on a journey from a patient's point of view and what you will be expecting should you ever need to go for a cystoscopy procedure. So by this time you would have probably seen me in the clinic, and there are a few reasons as to why that you need this procedure done, and that's essentially having a look at your bladder. Some of the reasons that we might have talked about includes the common ones like having blood streaks in your urine, or you were previously a smoker and that's why you have a particular higher risk of getting certain conditions, particularly in the bladder. That's why we've always need to check. Or if you have many urinary tract infection within a short period of time, or you have a previous history that a lesion was taken out from the bladder, and these are some of the reasons as to why you would need to have your bladder looked at maybe on a once-off basis or even on a regular basis. Now, the whole procedure itself, just to recap, you probably would have heard this already, but essentially it's a very short procedure, 3 to 5 minutes if I may say. Usually, you don't need to stay around in hospital overnight. It's a day procedure. You come in and you do the procedure and you go home. There are a lot of numbing gel involved in the entire procedure, so the whole goal is to make you as comfortable as possible. And essentially after the procedure is done, depending on whether you actually have any sedation or general anesthetics, you will need to hang around for 2 to 4 hours. If you do it under local anesthetic, the monitoring period is definitely a lot shorter, maybe just an hour or two. We gotta make sure at the bottom that you can have the food, have some food to eat and drink, and you can actually pass urine normally before we let you go. Now, this is how a cystoscope actually looks like, and whether you are male or female, you generally use the same kind of instrument. As you can see, it's basically a very nice thin instrument here, and this is the part that actually goes into the bladder. Over here at the tip of the instrument is basically a camera that allows me to have a good look inside the bladder to find out what's actually going on. Now, as I was saying, while this procedure is mostly done under local anesthetic gel, meaning to say we put lots of numbing gel at the urethra level, make sure you're definitely not feeling any discomfort. You can on occasion choose to do it under sedation, or in certain cases general anesthetic. Now, the difference between sedation and anesthetic is basically a different level of consciousness. Sedation is a lower level of consciousness whereby you might be able to open your eyes when I called you to, and you can breathe by yourself. Whereby if you were to do this under general anesthetic, you will be fully put to sleep, whereby you have no idea what's going on. We help you do the breathing, and by the time you wake up, you will be out of the procedure room already. And if you were to choose to do it under sedation or anesthetic, general anesthetic, generally that's when fasting for around 6 hours is required so as to reduce the risk of any problems when you were to do the procedure like vomiting because you are sedated. So we're going to basically spread out the whole journey into 3 parts. Pre-procedure, what are the preparation work that needs to be done for this procedure? A cystoscopy itself, what you're expected to go through step by step, and what to expect when everything is done. So to start off, usually around 3 to 5 days before the procedure, we would have tested your urine to make sure that you have got no urinary tract infection, because when you have urinary tract infection, you do not want to perform this procedure because it can actually make the infection worse. Now, assuming that you do not have a urinary tract infection, we will then proceed to tell you to basically do some preparation for it. Now, if you are on blood thinning medications like Plavix or aspirin, generally I actually do not require patients to stop these medications because I generally would not be too traumatic in doing the whole procedure, meaning to say I don't expect to have any injuries, and therefore I don't expect any bleeding, and so we could actually continue taking not just your blood thinning medications but your regular medications somewhat early. What do I mean? Let's say you're having a procedure done at 10 o'clock, you want to take the medications at around 6 hours before that. So in this case, you may have to wake up earlier, around 4 a.m. to take your medications for the day. If you want to have a grab a bite, yes, you can do so. Generally, we encourage patients to take early breakfast or early lunch, and that is defined as around 6 hours before your procedure. So essentially, if you're doing at 12 noon time, you want to stop eating after 6 a.m. You want to stop drinking, you want to finish your medications by that time, and then after, that's generally all there is to it. You just need to report at the allocated timing and make sure you come early so as to get the paperwork sorted out. Most importantly, relax and enjoy the ride. Now, when we are ready for you, generally you will be pushed into the theaters and asked to lie flat on the bed inside the theaters. And the theaters can be a bit cold, and you generally at this point in time may be feeling a bit cold because you only have the surgical scrubs on and you're wearing nothing underneath. We will then position you in the right manner and ask you to expose the lower parts of the body whereby we will be doing the scope. And rest assured, when we do this, we will take care to maintain your modesty. There will be adequate coverings of areas that I do not need exposed so that you will be as comfortable as you can. I will then proceed to do cleaning of the lower regions or the private regions. In this case, for the males, it will be the penis area, and for the ladies, it will be the vaginal area. And this is where you might feel a bit of a job because usually the cleaning solution can be either yellow or blue in color, and they can be quite cool to the touch. Once that is done, I will usually tell you that the area is sterilized, and I ask you not to put your hands down below where I've already cleaned before, because your hands can contaminate the regions again if you were to touch inappropriately. I will then be taking the anesthetic gel, and the gel is a bit special. It's actually a lubricant and a numbing gel at 2-in-1 combined together. And the whole point is that we will be basically putting the gel in the region whereby your pee comes out so as to be able to numb. At this point in time, the gel can sting a little, but I've always said to my patients, if it stings, it simply means that it's working in the right area that it's supposed to be. If you require a bit of sedation or general anesthetic, by this time we would have given you some of the medications and you might feel a bit goggly, or you will be fully asleep if you were to select for general anesthetic. The whole procedure itself takes around 3 minutes, and it should not take longer than that. Now, for those who actually would go through the whole procedure under local anesthetic, that is to say only with the gel, and you are fully awake, I usually invite you to look at the cystoscopic screen at the same time with me. Why? Two purposes. It allows me to tell you the various landmarks that you are looking at, so you have a better understanding of your own body, where everything goes in, where things come out. And secondly, it also helps to distract you so that the entire procedure need not be as tense as it has to be. Once that is done, I withdraw the scope and voila, we are done. The next step of the journey is basically we clean you up, wipe off all the excess fluid that might have been spilled during the procedure, and we keep you nice and warm with nice hot blanket. We wheel to the recovery area or the recovery room, and that is where we feed you, because after all you have not been eating for the last 6 hours and you might be hungry and thirsty, and we generally try to feed you as soon as we can once the procedure is done, because there's no reason to delay your diet. When you finish your food, we usually tell you to walk around and try to go to the toilet and pass urine as you normally will. This is to ensure that there are no issues after we've gone through the urinary tract, and you can pass urine normally. And as I always say to my patients, if you can eat normally, you can walk normally, and you can pee normally, you can go home. If you were to do this whole procedure with sedation or general anesthetic, we would actually recommend that you have another responsible adult to pick you up so that you can go home in a safe manner, because while we think that 4 to 6 hours of monitoring is sufficient for most people, some people can be a bit more sensitive and takes a bit longer for medications to actually the effect to go off. So in these situations, we would not recommend that you drive. We certainly don't recommend you make any big decisions in your life like signing your contract or your will immediately after general anesthetic. In fact, it is against the law. You should, however, have another responsible adult to bring you home and make sure that you get home in a safe and quick manner. I would then usually give you an appointment in around 5 to 7 days time, usually the following week, and to give you a debrief on the results of the cystoscopy that was done during the day. And generally try not to do it on the same day, because as I said, you might be under the influence of sedations and medications. You may not remember. If you do, great. If you don't, it's okay. You come back to me the following week and we can go through what happened during the scope again the following week.
So let's now take a look at some actual footages of what you expect in a cystoscope, and we are doing this in a male gentleman. So once, as you can see, we go in through the urethra and reach the bladder. The bladder, as you can see, is slightly wrinkled because it's meant to be a reservoir, so when it's not full, this is the appearances that we tend to get. And I'm putting water as we speak so as to expand it and smoothen it out. And very quickly we look at the first landmark that we expect to see. In this case, this is a little slit, and if you look closely, you might see a gush of fluid that's actually coming out. And this is actually the left uterine orifice, is where the left kidney connects to the bladder and empties out the urine. On the right side, similarly, you will see another similar structure, a little slit, and making sure these are all normal. And so once that is done, what I normally do is I will then look back by myself to look at the opening of the bladder. So in this case, you can see that I'm inspecting the opening, and you can see the black color rod that is the body of my own scope. And what I'm looking here is to look at the size of the prostate and see whether it's big or not. In this case, it's actually a very, very small prostate. And we have here our final structure, which is the verum montana, and we look at it to make sure that the prostate is not obstructing from this view. And with that, we come to today's topic on cystoscopy, and I hope that you were able to have a better understanding of what you expect to go through should you require a cystoscopy. The procedure itself is a very quick, short 3 to 5 minute procedure that doesn't require much preparation or a stay overnight. However, it gives a whole lot of information regarding the state of your bladder and tells us immediately what is going on in the bladder, if anything at all. You can do the procedure under local anesthetic, where you can actually look with me on your bladder together as we go through the whole procedure, or should you choose not to, you can do it under sedation and general anesthetic, and again there is no need to stay overnight for this procedure. Now remember to reach out to me if you got any further questions before we do your cystoscopy, or through our usual channels of communication. That's all that we have for you today, and I will see you soon in the next video. Bye.